The tape job that we're going to do today is for hyperextension prevention of the elbow. So we need to we're going to use a fan technique with our zinc oxide tape, and we're also going to have a anchor on the proximal and distal end of the arm using our we call it Lightplast is a company that makes it, or the name of it, but Howie's calls it something different. It's like flex tape, but it's sticky, right? But it's got stretch. So we're going to use that for our anchors because we got to think muscle here. When you start working on exercise, you're going to get perfusion and tissue expansion, and we can't put tape that's rigid on a muscle that's going to expand and just will feel uncomfortable and potentially cut off circulation. So we use a stretch tape for that. And we have our anchors, both proximal and distal, so humerus and forearm. So with our proximal anchor, we're going to just contract the muscles here and almost like just make it nice and tight here. There, just like that, perfect. And that's what we're going to do when we put the anchors on here. They're going to ask them to do that. Okay, relax for a second. You're okay with a little bit of spray?
Yep.
Okay, so for this one, we do need to make sure we have some pre-tape spray. It's going to ensure that the tape job stays sticky, especially when you get that force of extension on there. You need to make sure it's stuck to the skin. So if you don't, it's just going to slide right off and you're going to bust through that extension stop. Okay, so a little bit of spray, no allergies. No? Okay, you've been taped before?
Yeah.
All right, so turn your head to the left. Have to do that for the video, right? It's important. Yeah. Okay, so spray here. Oh yeah. And, good. And we're going to give that a moment here to dry off and get sticky. We're going to use heel lace pads on this one. Okay, we need to protect the cubital fossa. So we all just palpated that. We need to protect the biceps tendon and some of the other tendons around the elbow. So we just keep that in there. To hold that on, make sure it doesn't get in the way of the tape job, use some pre-wrap. Okay, so if I was doing this in a real situation, I would likely just put this tape around here on the pre-wrap and leave it there and then put all my anchors on the skin. But for the purposes of the video and demonstration, I don't want to, like, he has a little reaction to the tape from last week, so I want to just make sure that he's not going to have the same thing happen on the arm. So I will cover the entire arm with this. So we'll make our tape job a little less effective, but you should get the idea of the process. Okay, so nice and light, all the way down the forearm. Okay, like I said, normally I wouldn't do that. It would just be here, so I can go skin, tape to skin, but we'll protect the skin today. So anchors to start. I anchor with this tape. So just contract that arm for me. There you go, perfect. So I can go continuous as long as I leave the stretch in the tape. Okay, I don't want to take all the stretch out because now it becomes tape that's not going to allow for tissue expansion. So I leave the stretch. Good. So the stretch in that tape, and then same thing down here. I start the midpoint of the muscle belly, bulk of the forearm. Okay, and then I'm going to get down onto the musculotendinous junction, leaving a lot. See, there's still stretch in that tape. And then I'm on to like the more like just past halfway down the forearm. Okay, I've seen this tape job done almost like deltoid all the way down to the wrist. Okay, you get like this robo arm of tape job. And that's okay. You can do that, especially if you need a nice strong check rein. Okay, relax your arm for a second. So we need to prevent extension. So our pre-tape assessment. I should have done this before putting the tape on, but that's okay. Arms up for me, into a horizontal to the ground. Okay, so parallel with the ground. We want to see what his extension's like. We don't have any tape on there right now, so we can still do this check. Good, he's got about 0 degrees. Let's say he's got pain in extension because he hyperextended his elbow 6 weeks ago. He's done his rehab, he's getting back to play, but he wants to prevent that. He gets pain in that last 10 degrees, like, oh, that's a little sore. When that olecranon goes into the fossa, it stretches the front and it feels painful in the back. Okay, well, we take it back about 20 degrees. That's where we're going to try to put our check rein. So from there, our 20-degree flexion, we're going to measure anchor to anchor, there, okay? And I'm okay to go a little bit longer. I'd rather have too much than not enough, okay? So I measure that, so I got lots to play with there, and I'll show you what we'll do with that if we have too much. I'm now gonna just create my, you can relax your arm. Just gonna create my, call it check rein or a fan with a bit of a crisscross straight down the middle. Probably like more of a slender, smaller individual, you probably only need 3 strips. Someone you need a little bit more strength on that. You probably do closer to 6 strips. Okay, so I've created a fan here. All right. And the fan, the midpoint of the fan, you can tuck those in a little bit just to create some strength on the midpoint of the fan before you put it on, or you can do it after. And that's gonna be right on the cubital fossa. And we're gonna lay that on the biceps, okay? And then from here, I'm just gonna tack that down with some half strips. And I don't need to worry about him contracting, because I'm just tacking it down to my anchor, okay? And then that will peel down, and I will anchor that down. That's my extra. I can anchor that down there, okay? So from here, I need to check if I'm getting enough pull. So we're gonna put him in 20 degrees of flexion. We're gonna lay that down, and we're gonna ask him to extend. Go ahead and extend. Yeah, he can work through it. Remember, we have the pre-wrap under the entire tape job, so it's gonna slide a little bit. So maybe I want more. I'll take him into some more flexion. I lay that down, and now I anchor down with my hands. Okay, feels better. That's what we're gonna go with today. Good. I'm just gonna lay that down. Again, I'm gonna anchor this down with 2 or 3 strips, just to ensure it stays on. Okay. I've got the extra down here. Sorry about those small little hairs. There we go. It's not too bad. I'm just gonna peel that back. 2 options. You can cut that off if you want. I just peel it back on itself. Save me the hassle. And I just tape it down. And to be honest, it provides a little bit more support of that check rein, because it's kind of hooked now, and now it won't slide too much, okay? Do another check again. Yeah, it's pretty good, I think, right? Okay, so I can peel these on itself, so it creates a bit more stability through this so it doesn't rip, right? And now this is where the video ended last time, where we have this exposure. We don't want that because fingers can get caught in there, so we need to cover that up. So the way we cover the tape job up, same as the way we started with our stretch tape, starting at one end of the fan and just closing up to the other end, okay? The optional piece to this tape job is using, if you want a little bit more support, a little more spongy end feel versus the hard block end feel, you can have this tape. This is a stretchy tape. It's got stretch to it, but it's pretty thick. It's really hard to rip, okay? But we can use this to create a figure eight around the arm. And this is in the pictures on Canvas on your PowerPoint. You'll probably see this, okay? It wraps around the arm, and it does this like loop up here where we take a bit of stretch out of that tape, lay it down, and then leave stretch in the tape as we come around the arm for those obvious reasons, for tissue expansion, right? And from there, we can actually come back down again, take some stretch out of that tape, and loop back around. So we kind of do a figure eight, if you can kind of see that in your mind, right? That loop up here, loop down there, and crisscross around the forearm. Or sorry, crisscross around the cubital fossa. From there, we can slice that up, lay it down, okay? And now we get a little bit more of a, try to extend there, just feels a little bit more, just a little bit more of a tug, a little more prevention. Don't have to have that for the tape job, especially for examination. You don't have to have that, just an extra piece. So from now, we'll cover this up. Remember, we're leaving stretch in this tape, so lots of stretch in this tape as we loop around. We have 2-inch of this, which is what I'm using right now. There's also 3-inch in one of these boxes here, okay? And this is where I'm gonna crisscross here. So I need to close that up. And can I come up? And lots of stretch in the tape, okay? Some people like to close the elbow. You can leave it exposed, that's fine. So now try to extend again. Good. And arms up for me. Our post tape check, right? 0, and we're still getting there, but it's a dampening effect. It's slowing it down before it hard end feels, end blocks, okay? What did I forget to do beforehand? Skin blanch, cap refill. Yeah, good. So a skin blanch, you want to see 2 to 3 seconds, skin to return to normal color, or a cap refill, okay? And then function, we do a functional check. Basketball player, if that's a basketball player and they're right-handed, they're not going to want that on there, right? But if they're left-handed, that may be okay. Rugby, football, see this a lot in football, right? Soccer, goalies maybe.